Good morning, Vikram, and good evening, Raghu. So, I have two really amazing folks here with me on this panel. We'll be talking about global health access and equity. Um, we really had to straddle time zones today to bring Raghu and Vikram. So, please welcome Raghu Ram Lanka. He is the head of Reliance Geo Health in India. And I also have Vikram Dendi, Chief Product Officer and General Manager, Microsoft Health Futures. Welcome, both of you.
Hi. Yeah.
So, you know, with IdeaGen, we really bring together world leaders, NGOs, government organizations, folks on the ground. And one of the recurring themes is, health. Health impacts everybody. It's top of mind, especially right now with the pandemic, no doubt. And it's one of the core sustainable development goals from the United Nations. In fact, the goal 3 says health access for all ages. That doesn't leave anyone out in just those few words, right? So I've been working with both of you, and I was really impressed, wanted to bring you on here so that we can share with our viewers the work you are doing in health access and global health equity. So let's start with quick intros. Raghu, why don't you introduce yourself? Share a little bit about kind of what got you interested in health and a little bit about what you're doing at GL.
Okay. Hey, thank you, Sidhant, and Ideagen Global team for this kind invitation. So I'm probably not in the evening zone. Probably we are heading to the slightly night zone right now. But so first of all, I want to wish everyone a very healthy and back to regular life ahead. I guess I think and hope that we get back to our normal life as it was before. So about me, I head the digital health platform at Reliance Geo, and which is one of the fastest growing startups and also a fastest growing digitally connected platforms in India. From Reliance Geo is also a mobility platform and a connected fiber solution which has more than 400 million user base. Um, so so yeah, we are fortunate to be on a system that is well connected, and we would like to actually use this opportunity to actually go and solve the most important problem of pertinent to everyone, which is health.
Wonderful. Welcome, Raghu. Vikram, a little bit about yourself.
Great. Very nice to be here, and thank you, Sidhant, for the opportunity. It's always fun to hang out with Raghu as well, since we often get up to no good. I've been in the health space now for several years, but for all of us, I think we are in the health space since the time we are born. We are constantly thinking about our health, our family's health. And so it's been a privilege to spend the time over the last few years on this. By background, my history at Microsoft and before has all been in innovation, in figuring out how to apply technology and business model innovation for transformative effect on the world. And so here in Microsoft Health Futures, we focus on strategies that really move the needle for what we call health discovery and health delivery. So on the discovery side, it's about accelerating data and compute-driven methodologies for diagnostic and therapeutic innovation. And the delivery side is about dismantling barriers to access and transforming the delivery of care through new experiences and technologies. So access and equity actually cuts across both of these, but probably more on the delivery side right now.
Wonderful. Well, welcome both of you. This is a really important topic for me personally as well. I'm passionate about health. Um, so help me help me so that everyone in the audience understands vantage points for the two of you on how you apply to health equity, global access. So, kind of, what are some either personal or professional past experiences that got you to this point where you got interested in global health access and equity? So, Vikram, why don't we start with you?
Yeah, now when I look back at it, it sort of feels inevitable. I think I was one of those kids that I think has to have a lot of gratitude for being here today, to the doctors of my childhood. And so when we think about access today, it has it's easier to think of it as for somebody who's just getting introduced to it, they might think of it as just access to care. How proximate is a doctor to you when you need them, that sort of thing. And that is very much one of the core aspects of how we think about access. So when I was a kid, I grew up in a small town in South India, and apparently I used to get quite sick very often. And there was one time when my parents almost gave up on me because they had to get on a bus and take me to the city because there was not any like the care system in that town was not adequate. And they had to get off. They were the passengers in the bus sort of forced them to get off before the bus got to the city because things were looking pretty dire. And they were told there is a hospital here, you might want to just go there. And so they took me to that hospital, and thankfully I survived. And so that just kind of tells you how important access to care is. But then there is like the ability to afford it, the ability to put the patient at the center of it, which my friend Raghu will talk more about, and the ability to get the right level of care. So for me, I think that seed got planted back then, all the way back then. And I've been very keen on trying to figure out how we could address it and how we could improve it ever since then.
Wow, that's a really profound personal event that drove you to health. But it really underpins the story of access for probably millions of kids. And I cannot help imagine that some would not have been as lucky as you. Somebody probably missed the bus. Like there's a whole range of like real world things that happen and that just are not pleasant. Uh, Thank you for sharing that. Raghu, so what brought you to health and kind of how are you defining global health access and equity?
Yeah, so I would actually give it. So there are a lot of personal stories for me as well, but I think for me, I'll actually tell the story of about my aunt. So I was about 12 years old, and then so I have only one aunt, and then suddenly like we hear that she has a sort of a cancer, and so sitting in with my grandparents and then four of the children, like we're all just sitting there and listening. It appeared to be like a story, but everyone was very concerned and we just didn't know what's going on. Just the word cancer, there was a lot of concern in the house. And then I think that's introduced me to the world of there's something here, something way beyond the cough and cold that we typically get. Sometimes it's used to think of a way to not go to school and probably have fun, but something there is something more to disease and conditions which are a lot more serious. And the effect of it started hitting me when my mother had to go and spend about a month with my aunt. And so yeah, so in India, for example, like I was in a very small town towards the coastal, and my mother has to travel all the way to Mumbai or Bombay at that point. And then so almost like no one was willing to be with her, and we didn't know it was infectious. We didn't know anything about it. And this was a time around 90s in India when we just had a phone to connect between Mumbai to the place where we were. And so my mom was there. My dad went and dropped her off. They stayed together. My aunt had about a 2-year-old son who had to be with them while my aunt and uncle had to go and get the treatment started. So she came back about 2 to 3 months later, and we didn't know how to actually take my mom to the house, and there's a bit of apprehensions. Luckily for me, my grandparents, we used to stay in a large family together, so my grandparents were very receptive and sort of like and what went between between that when I was 12-year old to 15-year old helped me to understand that this is a problem that is really, really worth solving. There are multiple points that I learned there. One, that so it's very easy to actually go to a science fair and talk about cancer. That was what I was exposed to at that point. But understanding what it is, understanding the various versions of treatment and it is curable, and understanding the pain that a patient actually goes through when someone is a relative, and the family around it as well. So a lot of things that formulated my career as I moved forward was something that essentially originated in that period when in that period of teenage where I was exposed to the importance of the family in the whole healthcare ecosystem, importance of the knowledge of these conditions, and also the importance of the affordability, accessibility, as well as what you can you I mean we can also the acceptance and of the outcomes as well, when such a things actually happen, right? So I think that's where a lot of things that go forward are indicated with that
Yeah.
experience.
Wow. So I'm not surprised that both of you share a really profound personal experience and from childhood that drew you to, at this stage in your career, apply all of the knowledge, innovation, skills both of you have gathered uh, to, bringing health access to everyone else in the world. That's I'm proud to have both of you here and talking to you. This is fascinating. So you talked about, both of you talked about an event from your childhood, right? And that underpins like a particular issue. For Vikram, it was they were so far away from a hospital that just getting there is a nightmare and a full project in itself. And Raghu, you really underpinned something that has plagued us with different diseases. Now, cancer is no more infectious. But, I was just listening to a podcast yesterday and they were talking about schizophrenia, how it has a really negative connotation. And they are, petitioning to change the name, for example. So this is a common theme. So with that a little bit behind us and the work both of you are doing, leading two large teams, one at Geo, one at Microsoft. Uh, what would be a few top problems or themes? What are some of the vexing issues in global health access and equity? I know it's a really large topic. We cannot go and address all of it. But what is top of mind? What are some of the problems that is top of mind for both of you? So let's start with you, Raghu. Kind of what are the two or three problems that really float to the top?
Yeah, so I think so connecting to where I think where both I'll connect both the stories of what
Yeah.
Vikram and I were actually saying there, right? So there are three fundamental things that we sort of when you think of healthcare or from an accessibility point or equity standpoint, right? So the first one actually is think about so there needs to be accessibility from patient perspective, accessibility when we talk patient, or it's accessibility from an individual to a family perspective on the condition, and what you call as a number of here are the various options on the table, in a way as we call it, right? And then an ability to make a knowledgeable decision on that. So while we talked about cancer, this also goes to n number of things that we typically are on a day-to-day basis. Like for example, I take the case of COVID. So just having an SpO2. So the SpO2, by the way, is something that even I didn't know 2 years back. For all the knowledge we can think of being in healthcare, right? So we did never bother to look at it, but now it's a knowledge that everyone is aware of. But an SpO2 of a certain value has only a certain meaning given the context of the patient as well, and also in the prior history of it and all this stuff, right? So accessibility can have in a way of access of information, access of the state of an individual to the family is the first problem. I think is something that I believe from an accessibility standpoint. The second one is access to the necessary what we call as the doctors, or access to the clinical system to for this data or for this patient, so that a necessary what you call as clinical decision can be taken given the amount of information that is actually stored or mentioned, right? In India, it's a very important problem because a lot of us actually are, there isn't a very defined process of medical record collection. There is no standard way unless I as an individual have to go and do mostly like proactively go and do executive health checkups of a certain number of tests. Only then my data is actually present even in a PDF format, right? So not having access to this data essentially means that it's a blindfolded, it's essentially a blind decision making process, even for some very senior clinicians and so on. Um, so, um, so, so accessibility implies that one, an ability to collect the information, an ability to have the data, an ability to have it at the point when the decision is being taken, and the health equity, which is a far more profounding topic, is all about. We can actually talk about is that how do we bring a lot of this information to this, think of like an healthcare system at the right point, in a affordable way, in an what you call as an outcome driven way, in a way where the decision, when health outcomes actually can be more positive.
Okay, this is very interesting because Raghu, top of mind, you talked about, if I were to summarize it for our audience, essentially information gathering, processing it, and then supplying that information at the right time at the right place, right? And I think that's a very interesting perspective, because my naive perspective for a country like India would be logistics, right, or physical access, kind of like Vikram was touching upon. But given that, with your geo platform, you're touching, did you say 400 million users? Yes, so that's almost everybody, and I think you'll be touching everybody in another year or less. Um, so the point I think you're making is everybody will have a phone, has a phone, or has an easy access to phone, and so assume that is the logistical overcoming the barrier. How can I use that phone to kind of empower healthcare providers and the receivers with the right decision making tools? Is that a good summary of kind of how it might come together? I know I'm oversimplifying it, but it's very interesting for me to think about how logistical challenges are being overcome with a phone. Something like nobody, at least Vikram's parent, wouldn't have thought about, you know, a couple decades back while taking him to the hospital, right?
Yeah,
So,
nobody.
so Vikram, with the work you are doing in global health access, what are some what's top of mind for you in all of this broad topic?
Yeah, I'll build on top of what Raghu said. I think what's happening on the ground right now in places like India and Africa and even here, it's teaching us a lot. It's been pretty brutal on a lot of countries, everywhere actually. But there is also, some of the silver linings are that we are learning a lot about, how to think about, creating the right kind of resilience in our health systems. So I would expand, the term access, we're kind of using it broadly, but really it's more about health access, health equity, health resilience. And so I'll use that kind of framing as a way to describe, what the underlying challenges are, and where we are optimistic, very optimistic that we would be able to help move the needle if we work together collectively. So I see it as, there being like five areas that are critical. One of them, I mean, and Raghu touched on them already, but I'll sort of recap. So one of them is, connectivity, right? Like, and this is the more classical, right? Like access to care. How do you get to a care provider when you need care? And that could be a doctor, that could be a nurse, that could be a ASHA worker, who's, these social health workers. Like, how do you get to them when you need them? And that, as you both said, with the advent of mobile, almost ubiquitous mobile connectivity, it should be something that is doable today. And in some ways, we are actually like far ahead there than some of the other ones that I'm going to touch on. The second one is around affordability. So yes, you might be able to, you might be proximate to a doctor now, whether it is physically or digitally. But one of the things that I learned 10 years ago when I spent some time in India doing some field work on healthcare, one thing that was very common is, a farmer would stub their toes, have a pretty, significant wound, but would choose not to go to a doctor. It's, it'll heal, or can't really. And a lot of what was underlying that is loss of a day, right? Like, or being distracted from the thing that needs to happen, because a lot of them are cannot afford the break, right? And that, which in turn, can create more complications and things become worse, and it's a compounding thing. And so being able to create that connectivity, but also, do it in such a way that people don't feel like affordability is a barrier. And then that comes to the equity part. And then there is information. So this is really about how do you empower people to make smart choices, right? Like, my parents had no information, right? Like, they were trying to make the best choice they did, right? Like, getting on the bus was one decision, right? Like, getting off the bus was another decision. And there was no doctor advising them. There wasn't a good way for them to like make those decisions. And thankfully, they all worked out, right? So whether you are a patient that is trying to make decisions for themselves, or somebody who's caring for a patient, and then ultimately the doctors, right? Like, when a doctor is seeing you, and there is a huge variation in terms of how much training and access care providers get. And so the ability to actually make available information at the right time, that is tailored. So which then brings to like personalization, right? Like, this is where, being able to take a person-centric view, being able to take a holistic view, being able to take a longitudinal view of your health, so that you can make, smarter decisions about it. And then finally, something I think, Siddhant, you and I have talked about quite a bit, is what I call aggregation, right? Like, how do you actually look at sort of population level health? Because as you could see in pandemics, and things when there are outbreaks, this is one of the things where the folks who are making decisions, who are making public health decisions about deploying resources and so on, having really, really good information, right? Like, being able to make smart decisions is going to save many, many lives. So these are the five things that I see as being tightly interconnected and very much needed for having a resilient health system, an equitable health system, and ensuring access.
That's amazing, and seems like that's a really long to-do list ahead of us as technology innovators. And actually, Vikram, you touched upon something really interesting with the anecdote around the farmer stubbing his toe. um, Majority of the population in regions like these sustain daily on a daily basis by making daily income. So driving or taking a bus for 4 hours to see a doctor means loss of half the income for that day, and could mean the difference between a meal or no meal. So I think this to me really underscores the importance of using that phone, for example, that Raghu was touching upon, and providing the right information on the device you have in your hand, so that that farmer, instead of just letting it go, could at least be told to do this most basic of wound care, which is, hey, put an antiseptic, cover it, and do X, Y, and Z, and then tomorrow send me a picture, right? Because if the picture doesn't look good in 2 days, the doctor could possibly convince them. But it also highlights a larger issue. If the farmer just doesn't want to go to see a doctor, we honestly need to think about beyond healthcare, like economic incentives, or offset their lack of meal by coming to see a doctor, maybe even giving them literally a voucher to come see a doctor. So very interesting set of problems you both are highlighting. So let's chat a little bit about, both of you highlighted the problems, what's top of mind, a lot of revolves around information. So for each of you, how are you approaching that? Kind of what is the product you are building, or what is the research you are doing, and what are the countries you are getting into? So Vikram, let's start with you. Kind of what is your team up to when you put this in the backdrop? What's the solution? Let me jump to that. And there may not be any, but where are you marching to?
Yeah, I don't know that we would call there to be a silver bullet. There is if I had to really summarize the thought process that we have been adopting, we believe that, particularly accelerated by this pandemic, there is an immense amount of willingness, motivation, and to your point about how some personal experiences of ours have informed how we deal with healthcare. Can you imagine in the next 10 years or 15 years how many people, how many young people are going to want to be doing something about healthcare, given what has happened over the last few years? So we think that the conditions are really well set up right now, very ripe right now, to be very ambitious about healthcare. So as much as this looks like a really long list, I honestly think that our ability to really crack it and really do something that is transformative is here and now. And to that end, I think the most important thing, if I had to really like compress it all into like one thing, it is about creating the right coalitions. This is about trying to figure out how to remove the silos that have historically plagued health systems, right? Like, I mean, it's what is needed right now is ecosystem design and cross-sectoral partnerships. Every part that is involved with the healthcare world, right? If you're startups, historically what used to happen is, when I used to mentor startups, I used to always be like, take a very skeptical eye to healthcare startups, right? Like, I'd be like, do you understand what you're embarking on? How difficult it is going to be, right? How challenging it is to go up this hill, right? Because it was going to be so hard because of all the silos that exist, right? And but I'm much more optimistic now, right? And so similarly, enterprises, right? Like, not as a purely philanthropic or corporate social responsibility type efforts, right? But actually understand that this is a continuum, right? Like, there are people who need philanthropic help, but there are many people who are lifting themselves out of that spectrum into a place where they are becoming very important economic factors in how enterprises should be thinking about the world, right? Like, I mean, my admiration for what Reliance and Geo have accomplished. Like, I think many of their customers, right, like, were first-time users, right? Like, people who never afforded a mobile phone before. And this is true in India, this is true in China, this is true in Africa. Some of the biggest new companies, biggest new enterprises, are those who are catering to the people at that bottom of that very wide bottom of that pyramid, right? So enterprises have an important role to play. Nonprofit sector, who have historically done amazing work, right? Like, we work with friends at Global Fund and at the foundations and so on. They have historically also had challenges, going outside of the pure nonprofit lane, right? But creating cross-sectoral partnerships, thinking about, because ultimately patients, right, like individuals, they don't fall into any one of these buckets. They are just them, right? Like, all of these have to
Right.
work towards one person. And finally, public sector, right? Like, I think so across all of these, I think the mantra is, how do you create coalitions? How do you break down the barriers? As technology people, right? Like, that means How do you ensure that there is interoperability? How do you make sure that the patient data is not siloed? How do you make sure that there is an innovation surface area for startups? How do you ensure there is security and trust and privacy? So I'm very optimistic actually right now, more optimistic than I've ever been, that this actually becomes possible now. And in fact, while these problems exist everywhere, I actually think that places like India and Africa will probably set an example for how this can be done, because they don't have some of the legacy. They get to do this for the first time, some of the things at least.
Yeah. No, that's really fascinating work. And one of the highlights I took away from that is silos exist that has, historically just broken down innovation, especially for smaller companies. So you're proposing they're all going to come together, but there's still naive mechanisms for information to flow freely, right? And so we need a platform, we need that technology glue
Yes.
that will focuses on the patient, because you put it so succinctly that a patient isn't in silos, but the people helping the patient are in silos.
Yeah.
So if we can break down the barriers on how these silos can talk to each other, innovate, have information flow with the patient at the center, we can really supercharge innovation here and help bring health to everybody. That's
we
that's fascinating.
we have to create unconventional partnerships,
Yeah.
right? Like that's the key, right? Like we have no problem creating unconventional technologies or
Right.
breakthrough technologies, right? As you and I know, right? Like there is a amazing possibilities ahead with respect to cloud capabilities, edge capabilities, machine learning. But together with those, we also need unconventional partnerships, right? Like, people have to be comfortable working, figure out a way how to make it work, right? How do you work with the government? How do
Yeah.
you work with a nonprofit? How do you work with the startups, right? Like, and do it in such a way that it uplifts everybody and keeps the patient at the center.
Fascinating. Fascinating. Thank you for sharing that, Vikram. So, Raghu, I know I've seen brief glimpses of what your team is working on. You already have a product out there for the Indian population called Health Pathri. So, talk to us a little bit about what has been your mission for the last couple months. And I remember seeing your blog post you posted a couple months back, um, how you really cracked a user experience problem in Health Pathri. So, talk to us a little bit about the products you are building and the projects you will be building, if you can talk about those.
Okay. Yeah. So I actually was at Microsoft in the Digital India team between 2014 to 2016 to 2018. And I was actually on this side I mean, having been on the platform side and trying to see how we can actually elevate the platform to actually go and solve the problems of farmers, and as well as like the problem of the healthcare ecosystem. And I was part of the system that was really cracking it at that point in time. And a lot of me is has evolved working in those partnerships with all the key things that Vikram actually talked about. So some of those learnings, essentially, what I learned as part of that initiative is definitely the last mile that Vikram was pointing, right? So there is definitely a very good platform, the technical platform ecosystem built. There are also the end users who are getting into digital in some form of digital in India. And I'm using India, but this goes for most of the developing countries where mobility is no more a problem. Access to a smartphone is mostly there. In 2016, we were thinking of an SMS-based solutions, but by 2018, we are now looking into mostly like, hey, there is network connectivity. So, but there is still a disconnect between the last mile and the platforms, right? And there are three things that I thought were at that point as I listed down. First one actually is to build a personalized system, whether that be for health or for that for, and use the word health here. It could be for a plant, then it becomes a farmer as the end user. If it is the life of a fisherman, like whether it plays a pivotal role for a fisherman when he's going for fishing into the sea. So again, the that's you can think of like identifying the health actually has multiple aspects. The other aspect he was talking about was where we stopped a previous conversation was it's always a decision between life and a livelihood. It goes for the farmer, it goes for a fisherman, it actually goes for even for a human being as well. For each of us individually, for our own health. Sorry. So, and that essentially starts with identifying what you call as a state. We always start given this state and given an event that triggers it, then you can build a knowledge platform that can identify, is this an actionable event that should, and the criticality of it then can be defined again by a very good intelligent platform. But again, that the end action should be translated back into a response that is consumable, backed by this individual. So, so a state machine is something that we are well used to in any of the AI systems to really go and build. So, a state machine that is really personalized. While we are so lucky that on a today in agriculture we have a very good state machine. We have remote sensors. We actually have satellites looking at our crops and then monitoring it. But you go back to the individual human health, that state machine itself is not clearly defined because the parameters that are used to measure have to be motivated by each of us to continuously measure, track, so that that state machine can actually be built. So that's your problem number one, right? So how do we get that to a point where that data can be collected? The standardization part, which Vikram talked about, is the second part of it, where the rest of the entity standardization that Microsoft Health Analytics and others actually are providing, where some part of those problems are really solved. But again, an entity standardization in multi languages, in a combinations of words and in a combination of context, have very very different meaning altogether. So India gives India, and I'm using India here, but it is that there is a lot. It's not about translation problem. It's a localization problem. It's a context problem, given the state of the individual, that has to be built into the system. And getting to the state of one is a very very hard problem that each of us have to go and match on, right? So that's your second one. The third one that we sort of like looked at is, okay, I think there is a focus definitely on data entry. There is a focus on data standardization. There's a huge focus on knowledge graphs and building this system for reasoning. But unless we close the loop of giving this alert back to the individual for making that decision, then again we are back to square one.
Yeah.
So that's where I think the last 3 years have focused on. We have built this app called Machli, which actually stands for a fish. It also is my native town, Machli Patnam, which is a town. We had to name something, so I said, why not localize it to the place where I was born, and that is how it translated it. But the thing we focused on is, for a fisherman to make a decision to go to a sea or not, a weather forecast is only so much accurate. We can really beat it out, but 50 kilometers down, no one knows what's going to happen, right? And it takes the same amount of time, if not more time, depending on the current direction, for them to come back. So what we did was that we picked up the radio artists who typically talk in that native places, and we used their audio voice for automating the advisory. So, and that actually built trust to someone who was listening to that forecast. It's as if they were listening to the same weather forecast that was coming to them, except the previous weather forecasts were coming, which were at district level, but today they were receiving at the exactly at the center level. So this is how we translated, an insight with an AI-driven system to something that can be trustworthy system. Expanding that now into healthcare, the first and foremost is that, how do you indicate to a person whether the person is healthy or not? I always start with that in most of the conversations. Hey, are you healthy? And hey, I look healthy. Doesn't mean I am healthy. And second is that if I am healthy, then would I continue to be healthy given another event is going to happen? And that's where the whole notion of, can we represent a human in a simple red, yellow, and a green box, which a lot of our literature is already indicating to us. So we took the existing knowledge, which today comes as part of our lab report, saying that given a person of this age and this comorbidities and this condition, this value seems to be in the range, out of the range, or maybe a critical one. So we used that as the base premise. So took all the standardization and sort of like color coded. And going back to the family concept now I was talking about. So most often, right, like we always say, I always feel I am healthy, right? But but if I have any condition, it's my wife who becomes a lot more interested. Like she would like to actually, she's the one who nudges me to get to a caretaker. It's always we call as health is all about love and care. And most of us enter into the system only when we are nudged into the system. And particularly in the preventive care, this becomes very important. Like my dad would never test his diabetes on a daily basis unless he knows that I am actually on a daily basis going to check his blood glucose every day in the morning. It's
Interesting.
not about, I mean, he has a very cost optimization that he runs, saying that he figured out that once a week is sufficient to find out. And once he has a comfort that it's not cost optimization anymore, but it is that his son is monitoring his diabetes, sort of like translated him into tracking his fasting glucose every day in the morning. And he knows that if it is yellow, he knows that Raghu is going to say something. If it's red, then immediately he WhatsApps me and then he tells me that, okay, I know it, I'm going to control it, and so on. So this is a very personal story, but something where we could get his HbA1c at an uncontrollable rate, because he knows exactly when to test so that his numbers were always on track. But now we were able to track and then really get him on track even
Wow.
during this time frame as
So
well.
this is very interesting. So you're closing the loop on the all of the information aspects we talked about, but I think really something really interesting you're highlighting is we've learned in healthcare that closing the loop is not sufficient because people are inherently lazy or they themselves think they know better. Sometimes they do, but most often not, like in the case of your dad where once a week is not good enough. So you're bringing caretakers, actually family, into the loop, in a closed loop, into that system, and that clearly is producing miraculous results in how people are able to monitor their health and take action and be invested in it. Now this is really fascinating. For example, going back to Vikram's farmer example, you could imagine he may write it off as, no, I'm not going to waste a day, but their spouse or children might say, no, we'll take care of the meal or we'll do something else today extra. You should go see your doctor. You should not skip that. See, right now there's no mechanism to bring those family members into the loop.
So,
That
by the
becomes,
way, and this sense of community, right? Like, I mean, the family is your initial community, right? But this
yeah,
sense of community is something that is starting to become so powerful. Even in the context of like the US right now, these are many of the things that we talked about, are actually challenges for lots of pockets of population. And these community health organizations are starting to form. So in the farmer example, you can imagine, right? Like if it is not his immediate family, you can imagine that there are these farmer cooperatives and so on
right.
that might have a mechanism, right? That might say, you know what, we will lend some help,
Yep.
right? Like some other farmer will come over and help out today. You should go, right? Because that even that, right, like is a mechanism to like really encourage somebody to get timely help.
Yep. No, that's fascinating. So we are almost out of time, and I have two short questions, right? One is, you both are doing this amazing work, which seems to me, and it's clear to me, is a massive heavy lift. So IdeaGen community, like I mentioned early on, is corporations, NGOs, folks on the ground, community health workers, nonprofits, for profits, and governments. So all the silos, Vikram, that you touched upon is in the audience here. So I really want to like have a few lines, like if you're looking for, you said you're looking for unconventional partnerships, and Raghu, you're doing these deployments in India. Do you have an ask of the community? Can they reach out to you? Are there collaboration opportunities? What do you want to say to them? So let's start with you, Raghu.
Yeah, of course. I mean, this is a universal problem, and I don't think there is one person take all here. And there is actually um, so so the thing about this, we think of it like there is a burnout happening across, right? As individuals, we are burnout of the stress that we are going through, a continuous COVID that is going through. As the healthcare providers, we are getting burned out because of the continuous churn that is actually happening, and the amount of I mean, we really want to do really good things, but we can only scale so much. I think if there is anything that any digital platforms can provide, it is now. If there is anything that communities can come together to solve this burnout problem, it is now. I think like what we are trying to do as part of, whether that be like Joe Digital Health, or whether that be Microsoft Digital Health, like where my Vikram is coming in. It's about building those communities and then sort of like utilize our key strengths. I'm not talking about just Microsoft here, or for that matter, maybe it is NGOs. Everyone, each of us can come with our strengths, hook into this ecosystem that is being created, and help reduce this burnout. If there is a time, it is now. If there is any time for us to where there is acceptance of any solution that can really reduce this burnout and help us get back to life and like become positive, we are all here to really like explore those possibilities and get in this system. Communities of doctors, community of NGOs, communities of translators, community of health workers, even community of families, where you have access to people who need any sort of help. uh, Here is an opportunity to get in.
Wonderful, wonderful. And Vikram, how about you?
Yeah, no, I've always admired the Idea Gen community, and I mean, what a great opportunity right now to actually come together and find ways to be creative and overcome some of the history and create the future. You know, overall, like when you think about the societal and economic benefits of really tackling health today, there's a couple of really interesting data points around how like the global burden of disease, like on the innovation side, right? Like there are lots of idea gen folks who are innovators, right? And right now, you know, you can decrease the global burden of disease by about 6 to 10% through just 10 new innovations, right? And then likewise, you know, you could, and what's really interesting comparison to that is you can decrease the global burden of disease by 40% by applying known interventions to broader segments of the population, right? So, and that's the societal benefit of like really going after it right now. So, if you're an innovator, you know, if you are someone who has reach into broad populations, you know, give it some thought. Think about how you can participate, you know, in this collective effort. And then, of course, you know, for enterprises, you know, that are thinking about economics of this, if we create greater access, you know, the economic benefits of that would add $12 trillion.
Wow.
That's 8% to the global GDP by 2040. So there is like no excuse whatsoever. So please reach out. I am Vikram.Dendi at Microsoft.com. And I know how to find Raghu also. So, but really, like we would very much welcome, no matter which of these lanes you operate in, we very much welcome you
Yeah.
joining.
No, I would really encourage. So, IdeaGen community, if you want to reach out to Raghu or Vikram, I know Vikram shared his email, but you can also reach out to IdeaGen, and the team can put you in touch with Raghu and Vikram, and you can, carry on a conversation from there. So, in closing, I want to ask one last question very briefly. A really important part of IdeaGen are the emerging leaders and the youth. And some of our audiences are actually in high school, are in colleges, and some are really just starting their careers in corporations and government entities. And I like to call them emerging leaders. Like I've met them, I've seen what they're capable of. What is one key learning that you want to share from your personal or professional life that you would share as advice or a success secret with this population? So Raghu, one key learning.
Yeah, so actually, I can share the story of my own daughter, right? So, where she's 10-year-old, and in her school, they are actually teaching her what's a virus and its impact. So, yesterday I was talking to you, Sidhant, when that this is where, and I didn't know what a virus was until I was forced to read 2 years back. Unfortunate for me, but coming, but I think the beauty of the current generation is that you're so lucky to actually be exposed. At some point, we were forced to say STEM is important. This own crowd has been at Microsoft. There's been a lot of leverage around the importance of STEM education. But now I think I don't have to convince my daughter to do sciences. And I think that's where sciences are critical. And the future for us is all about focusing on some of those key fundamental aspects. Going back to basics is what we always call as technology is evolving, the basics and the fundamentals is where if the new gen leaders can actually focus on your ideas, and the freshness is what is really going to save the world. So please don't expect that gray hairs like us have anything more. We are not wiser, but it is these children of 10 years who are coming with fantastic ideas, and we need to nurture them, grow them, and they are the ones who needs to be funded to really become the next saving population for us.
Wonderful. Vikram, what is your one key learning that you want to share?
I don't know that I could really add much to what Raghu said. I mean, it resonates with me so strongly. I think the thing that I have always, in some ways, like we've learned a lot of these things late, right? Like we've had to go through a lot of experiences. So to that end, maybe if we can give you something that helps early, that would be fantastic. So to that end, one piece of advice I would say is don't let something else define what you are or what you want to do, right? Don't let it be like, oh, I want to go work at Microsoft, and Microsoft sets, I'm using Microsoft as an example, but Microsoft gives you that credibility or that vantage point or whatnot. It's same thing about like which university you go to, or what kind of job you have, title, and so on. Think of yourself as your own startup, right? You individually is a startup. So now think about how you're going to optimize, like what is the best possible, most impactful thing that you can do. And this may be, I mean, especially if you are like really early in your career, this may seem a little bit weird, but over time I think you will learn that the ability to multiplex yourself, right? Like the ability to make sure that all aspects of you are optimized, right? Like where your learning is optimized, your ability to do passionate, things that you're passionate about is optimized, right? Like that is going to be really, really important. I think historically and culturally as a society, we have often tried to tell people, oh, here's a path you should follow, right? Like that lots of other people have gone down. And I call BS on that. I think that, get those fundamentals in learning, like what a virus is, et cetera, right? Like that's important, good education. But outside of that, design for yourself the path that you want to follow, and optimize for you having many innings over your life to keep improving how you are impacting the world and yourself.
That's great. That was great advice from me, both of you. I so absolutely no, this is wonderful. So I want to thank both of you for all of the time. I think this was such an energizing conversation. Clearly, this is a momentous task, and we have to get it done. Global health and equity, underscores everything. This pandemic has shown us that. And I loved how both of you are accepting collaborations, thoughts, feedback, and collaborations with open arms. I really hope folks from IdeaGen community and some of our younger population will reach out, for either advice or possible collaborations. So thank you, Raghu. Thank you, Vikram. It was a pleasure having you here on IdeaGen panel. Thank you.
Yeah.
Thank you, Siddharth.